Hi folks, Doc Jake from Sioux Nation Ag Center here. It's that time of year when cattlemen can see the most terrifying sight you can see in the summertime. There it is! Pinkeye!
Yes, pinkeye, that disease we love to hate. So when we see it, when's the best time to treat it? And then what do we use to treat it so we can have the best results? Now, since there are many stages in the development of pinkeye, it's important to treat this animal at the earliest stages. That's when the eye might have just this little pink ulcer in the middle of it. You might see the animal wincing their eye because it hurts and water draining from it. Don't confuse it with a little dust in the eye. We may see the water draining from the eye, but if there's no ulcer and the animal's not wincing, we're probably not looking at pinkeye, especially in dry, dusty conditions. Now, if the eye advances to later stages where the eye is white or even bulging out because of the pressure inside of the eye, we're a lot less likely to see success with our treatments. As soon as we can see these little dots and we can get those animals treated right then, we're much less likely to have a blue eye on that animal. Now, when it comes to remedies for pinkeye, there's a lot of things people will try. The first thing I want to talk about is putting patches on the eye, or perhaps sewing the eye shut in order to keep the sunlight off the eye. It does have the advantage that it makes all of your cattle look like pirates. However, if we look at the data, we don't see a difference in cattle that are simply treated with an injectable antibiotic versus the ones that are treated with an injectable antibiotic and given a patch or an eyelid suture in the long-term health of that eye. Basically, it doesn't seem to make any difference whether we do this or not. I think the big thing that this does is then we just don't have to look at how ugly that eye gets while it has a patch over it. There are a number of other remedies people try, from injections in the eyelid of different medications to sprays. The data will say that the best results we get is using an antibiotic injection in the neck to get the best results in actually clearing up the pinkeye. The good news with this is it makes treating the animal very simple. One caveat I will throw out there. It does seem, at least anecdotally in my experience, that if you can isolate the animal that you treat for 24 hours after you treat it, you seem to slow the progression of the pinkeye outbreak in the herd. Now, as far as what antibiotic to use, LA200 or a derivative of that is typically enough to clear up this infection. We are seeing some resistance though, and in these cases we're better off using a macrolide antibiotic, such as Draxxin or Zactran or Zuprevo, fill in the blank. Now, the other thing that I would say when you're treating these calves, if you are in a situation where you have to use a remote delivery system like a dart, do not use LA200. It does not go through the dart, and you're unlikely to get enough of a dose to treat the calf adequately.
Look, Doc, I got pink eye all over the place. I treated 6 of them today. I got 4 of them yesterday that I treated, 3 of them on the watch list. How do I put this fire out?
That's an excellent question, Generic Rancher Ron. In that situation where you have an outbreak that's going to spread through the entire herd, it's better to simply get ahead of it by treating the entire herd in one shot. What I would recommend is if you have animals that have no or very minimal signs when they're in the chute, use LA200 or a derivative thereof to treat those animals. But if you have animals that have severe signs, I would use a long-acting macrolide like those I listed before. This way, you get antibiotic into all the animals since the disease is spreading through all of the animals at once, so we can stop the progression in its tracks. If you have any other questions on how to treat pinkeye or identify it in your herd, feel free to reach out to us at Sioux Nation Ag Center. Our veterinarians can help you identify those pinkeye problems, as well as give you some tips on how to keep the problem a little more at bay. My suggestion is ask us about fly control. Because if we can treat these animals in a timely manner, they'll feel better, so they'll gain better. And of course, that's critical to feeding that bottom line. If you have any other questions with treatment of stuff,
How do I put this fire out? It came out all right.
That was a good shot. We got to get that in slow motion.
Now, as far as what antibiotic to use, LA200 or a derivative. There we are, derivative